CNA Practice Test questions and answers.
Clients with osteoarthritis may be on bed rest for prolonged periods. The nursing assistant is aware that she should
A.
encourage coughing and deep breathing and limit fluid intake,
B.
provide only passive range of motion and decrease stimulation,
C.
have the client lie as still as possible and give adequate massage,
D.
turn the client every 2 hours and encourage coughing and deep breathing. Correct answer, D. Turn the client every 2 hours and encourage coughing and deep breathing. A bedridden client needs to be turned every 2 hours, have adequate nutrition, and cough and deep breathe to prevent potential complications of pressure ulcers and pneumonia. Massage can minimize the pain, but placing the client immobile is not the correct answer. Active and passive range of motion exercises and hydration are also appropriate answers to prevent contractures and promote skin integrity. Justine, CNA, was instructed by the staff nurse to elevate the client's casted left limb to prevent swelling. Justine is elevating the casted extremity correctly when she does which of the following?
A.
Places the casted limb above the level of the heart.
B.
Places the casted limb close to the body.
C.
Places the casted limb below the level of the heart.
D.
Places the casted limb at the level of the heart. Correct answer, A. Places the casted limb above the level of the heart. A nurse obtains an order from a physician to restrain a client by using a jacket restraint and delegates a nursing assistant to assist in the restraining of the client. Which of the following observations indicates inappropriate application of the restraint by the nursing assistant?
A.
A safety knot in the restraint straps.
B.
Restraint straps that are safely secured to the side rails.
C.
Jacket restraint straps that do not tighten when force is applied against them.
D.
Jacket restraint secured so that 2 fingers can slide easily between the restraint and the client's skin. Correct answer, B. Restraint straps that are safely secured to the side rails. The restraint straps should be secured to the bed frame and never to the side rail to avoid accidental injury in the event that the side rail is released. A half bow or safety knot should be used for applying a restraint because it does not tighten when force is applied against it and allows quick and easy removal of the restraint in case of emergency. The jacket restraint should be secured, and 1 to 2 fingers should slide easily between the restraint and the client's skin. The nurse inserts a Foley catheter to relieve a client's urinary retention. Which of the following is an inappropriate action in caring for clients with an indwelling catheter?
A.
Emptying the drainage bag every 6 to 8 hours.
B.
Attaching the drainage bag to the lowest part of the side rails near the client's feet.
C.
Keeping the drainage bag below bladder level.
D.
Positioning the tubing without dependent loops. Correct answer, B. Attaching the drainage bag to the lowest part of the side rails near the client's feet. The bag hangs from the bed frame, chair, or wheelchair. It must not touch the floor. The bag is always kept lower than the client's bladder. If the drainage bag is higher than the bladder, urine can flow back into the bladder and an infection can occur. Therefore, do not hang the drainage bag on a bed rail. When the bed rail is raised, the bag is higher than the bladder level. When the person walks, the bag is held lower than the bladder. Emptying of the drainage should be done every 6 to 8 hours to prevent proliferation of microbes, which can develop into infection. The tubing should not have dependent loops to prevent stasis of urine in the tubes, which can promote backflow to the bladder. Elderly patients are prone to stomach aches and bloating. Which of the following foods are avoided since they are gas-forming and contribute to the said condition?
A. Prunes. B.
Cauliflower.
C.
Colas and sodas.
D.
Protein-rich foods. Correct answer, B. Cauliflower. Cauliflower is gas-forming. Other examples of gas-forming foods are beans, cabbage, radishes, and cucumbers. In preparing client for a hot sitz bath, the nurse assistant should check the temperature of the water. The ideal water temperature is
A.
between 105 degrees Fahrenheit and 120 degrees Fahrenheit.
B.
Between 95 degrees Fahrenheit and 110 degrees Fahrenheit.
C.
Between 80 degrees Fahrenheit and 93 degrees Fahrenheit.
D.
Between 65 degrees Fahrenheit and 80 degrees Fahrenheit. Correct answer, B. Between 95 degrees Fahrenheit and 110 degrees Fahrenheit. The ideal temperature of the water for a hot sitz bath is between 95 degrees Fahrenheit and 110 degrees Fahrenheit. Water that is too hot will burn the client, and water that is too cold will cause the muscles to tighten up rather than relax. A hot sitz bath will provide relaxation and relieve muscle spasms, soften exudates, hasten the suppuration process, hasten healing in cases of perianal surgeries, reduce congestion, and provide comfort in the perineal area. The nurse has delegated the following order to you. Obtain a urinary specimen to test for sugar and ketones in a client with a medical history of diabetes mellitus. You are aware that you will obtain the specimen
A.
at bedtime,
B.
30 minutes after meals and at bedtime,
C.
30 minutes before meals and at bedtime,
D.
before breakfast. Correct answer, C. 30 minutes before meals and at bedtime. In diabetes, some sugar appears in the urine, glucosuria or glycosuria. The diabetic person may also have acetone, ketone bodies, ketones in the urine. To determine the presence of these substances in the urine, these tests are usually done 4 times a day, 30 minutes before meals and at bedtime. The doctor uses the test to make drug and diet decisions. Double-voided specimens are best for these tests. The nurse aide was asked by the licensed nurse to change the non-sterile dressing of a client. Which of the following statements is best when pertaining to this situation?
A.
Tactfully refuse the delegated task because you are limited in changing dressings on your own.
B.
After the wound has been cleansed, apply clean dressings and tape completely around the edges of the bandage.
C.
In cleansing the wound, start from the surrounding skin towards the wound in longitudinal strokes.
D.
In changing a dressing, always note the color, odor, amount, and consistency of the drainage on the old dressing. Correct answer, D. In changing a dressing, always note the color, odor, amount, and consistency of the drainage on the old dressing. Dressings that do not require the use of sterile technique or to apply medication to the wound will often be assigned to your care. Make sure that you follow the correct steps in doing the procedure, such as cleansing the wound and the skin using circular motions, and start from the clean areas to the dirty. The wound is considered clean and the skin dirty. Apply clean dressings afterwards. Hold all dressings by the corners as you apply them. Do not contaminate the center of the bandages. Tape the dressing in place, leaving the edges free. Do not tape completely around the edges of the bandage. Which is correct about ostomy care?
A.
It is done under sterile technique.
B.
It needs doctor's order for changing of ostomy pouches.
C.
Able clients can perform this procedure by themselves once they have been taught by the nurse.
D.
The client can still defecate normally. Correct answer, C. Able clients can perform this procedure by themselves once they have been taught by the nurse. Ostomy care is done aseptically. Rules of cleanliness. It does not require a doctor's order for changing the ostomy pouch. The collection bag must be changed when it is full or when the adhering seal is broken. A client with ostomy will have a change in the normal bowel movement. The fecal matter will be collected through an appliance that is held over the stoma by a special adhesive or paste. A client has a deep vein thrombosis, DVT, and has orders by the doctor to apply elastic stockings. The nursing assistant is correct in performing this when she
A.
applies the stockings while the client is on bed,
B.
applies the stockings while the client is sitting on the chair,
C.
applies the stockings while the client is sitting on the bed and dangles her feet,
D.
applies the stockings while the client is standing. Correct answer, A. Applies the stockings while the client is on bed. Elastic stockings or anti-embolic stockings are applied before the client gets out of bed. Otherwise, the legs can swell from sitting or standing. Stockings are hard to put on when the legs are swollen. The client lies in bed while they are off. This prevents the legs from swelling. The nursing assistant is aware that the purpose of the elastic stockings is to
A.
prevent blood clots,
B.
hold dressings in place,
C.
reduce swelling after injury,
D.
prevent pressure sores. Correct answer, A. Prevent blood clots. Elastic stockings exert pressure on the veins. The pressure promotes venous blood flow to the heart. By doing so, the stockings prevent blood clots. A COPD client recently admitted to the floor needs constant oxygen therapy. When assisting this patient, the nursing assistant can
A.
turn the oxygen on and off,
B.
start the oxygen,
C.
decide what device to use,
D.
keep the connecting tubing secure and free of kinks. Correct answer, D. Keep the connecting tubing secure and free of kinks. The job of the nursing assistant is to make sure there are no kinks in the tubing and to secure the connecting tubing in place. The other choices are all responsibilities of a physician. After applying an elastic bandage to a client's right leg, you need to check the color and temperature of the leg.
A.
Every 15 minutes.
B.
Every hour.
C.
Every 2 hours.
D.
Every shift. Correct answer, B. Every hour. In applying elastic bandage, expose fingers or toes to allow circulation checks. Check the color and temperature of the extremity every hour. If the person complains of pain, itching, tingling, or numbness, remove the bandage and tell the nurse at once. Which of the following statements is correct pertaining to binder's application?
A.
A breast binder can be applied for breastfeeding mothers to relieve discomfort.
B.
Straight abdominal binders are applied when the client is sitting on a chair.
C.
The double T binder is specifically used for male clients.
D.
When securing a straight abdominal binder, help the client in a side-lying position to close it at the back using safety pins. Correct answer, C. The double T binder is specifically used for male clients. T binders secure dressings in place after rectal and perianal surgeries. The double T binder is for men, while the single T binder is for women. A breast binder is specifically used to support the breasts after breast surgery, not by breastfeeding mothers. Straight abdominal binders are applied with the person supine. It is secured in front of the body by safety pins, Velcro, zippers, hooks, or other closures. The top part is at the person's waist. The lower part is over the hips. Protective devices are often used to prevent and treat pressure ulcers and skin breakdown. Which of the following devices is least likely used for this particular purpose?
A.
Trochanter rolls,
B.
rubber sheet,
C.
bed cradle,
D.
flotation pads. Correct answer, B. Rubber sheet. A rubber sheet protects the client from soiled linens and excess drainage. It can even predispose the client to develop skin breakdown and pressure ulcers because it creates moisture and friction to the skin. Trochanter rolls are applied to prevent the hips and legs from turning outward and aids in proper positioning of the client. A bed cradle is placed on bed and over the person. Top linens are brought over the cradle to prevent pressure on the legs and feet. Clients requiring oxygen therapy should be monitored for hypoxia. Early signs for hypoxia include
A,
breathing comfortably only when sitting,
B,
restlessness, dizziness, and disorientation,
C,
cyanosis and increased pulse rate,
D,
increased temperature and decreased respiratory rate. Correct answer, B. Restlessness, dizziness, and disorientation. Hypoxia means that the cells do not have enough oxygen. It is a life-threatening condition. The brain is very sensitive to inadequate oxygen. Restlessness is an early sign, as are dizziness and disorientation. Hypoxia will have increased respiratory rate, increased pulse rate, but not increased temperature. Cyanosis, or bluish discoloration of the skin, is a late sign of hypoxia. An asthmatic client can be relieved from dyspnea when he is placed in orthopneic position. This can be done by
A,
placing the head of bed in 90 degrees angle,
B,
sitting up and leaning over a table with a pillow,
C,
hyperextending the neck while on high back rest,
D,
placing the client on a high back rest using a pillow. Correct answer, B. Sitting up and leaning over a table with a pillow. Clients with difficulty breathing often prefer sitting up and leaning over a table to breathe. This is called orthopneic position. Place a pillow on the table to increase the client's comfort. Which action is incorrect when flossing the client's teeth?
A,
Hold the floss between the middle fingers of each hand.
B,
Make sure you also floss the back side of the very last tooth on the right, left, top, and bottom of the mouth.
C,
Move the floss gently up and down between the teeth.
D,
Use a new piece of floss for each tooth. Correct answer, D. Use a new piece of floss for each tooth. It is unnecessary to use a new piece of floss for each tooth. Break off an 18-inch piece of floss from the dispenser. This will do for all the teeth. Just move to a new section of floss after every second tooth is flossed. The other choices are correct steps in flossing. To obtain a 24-hour urine specimen, the nurse assistant should
A,
collect each voiding in separate containers for the next 24 hours.
B,
Discard the first voided specimen and then collect the total volume of each voiding in 24 hours.
C,
For the next 24 hours, retain a 30 milliliters specimen of each voiding after recording the amount voided.
D,
Keep a record of the time and amount of each voiding for 24 hours. Correct answer, B. Discard the first voided specimen and then collect the total volume of each voiding in 24 hours. A 24-hour urine specimen is a collection of all urine by a client over a 24-hour period. All urine is collected for 24 hours, usually from 7 a.m. on the first day to 7 a.m. the following day. It is necessary to ask the client to void and then discard this voided urine. This is done because this urine has been in the bladder an unknown length of time. The test should begin with the bladder empty. For the next 24 hours, save all the urine voided by the client in one collection bottle. Recording the amount of urine and the time voided is not important in this procedure. A client was fitted with a hearing aid. She understands the proper use and wear of this device correctly when she says that the device is turned on and adjusted to A. Therapeutic level,
B,
preset level,
C,
prescribed level,
D,
audible level. Correct answer, D, audible level. The hearing aid should be adjusted to an audible level that the client can tolerate. A hearing aid helps the person hear more in both quiet and noisy environments. One of your clients just had a stroke and is manifesting receptive aphasia. Clients with receptive aphasia
A,
are unable to speak.
B,
Have no difficulty in understanding spoken or written language.
C,
Are not able to express themselves meaningfully through speech.
D,
Speak very loudly at all times. Correct answer, C. Are not able to express themselves meaningfully through speech. Receptive aphasia is also known as Wernicke's aphasia. It is a type of aphasia in which an individual is unable to understand language in its written or spoken form. Even though they can speak using grammar and syntax, they usually have difficulty expressing themselves meaningfully through speech. People with receptive aphasia are typically unaware of how they are speaking and don't realize that their speech lacks meaning. The nursing assistant is aware that the responsibility for keeping an accurate INO record is part of her duties. If the client is incontinent, how should she document the output?
A,
Inform the nurse that the client has voided or defecated.
B,
Do not document at all since it cannot be measured.
C,
Record on the output side of the INO sheet each time the bed is wet.
D,
Review the client's intake and record the same amount on the output side of the INO sheet. Correct answer, C. Record on the output side of the INO sheet each time the bed is wet. If the client is incontinent, cannot control bowels and or urine, record this on the output side of the INO sheet each time the bed is wet. Even though the urine cannot be measured, it will be obvious that the client's kidneys are functioning. Which of the following are examples of fluid output that need to be recorded on the INO sheet?
A,
Urine only.
B,
Urine and blood loss.
C,
Urine, blood loss, and excessive perspiration.
D,
Urine, emesis, blood loss, and excessive perspiration. Correct answer, D. Urine, emesis, blood loss, and excessive perspiration. Fluid output is the sum total of liquids that come out of the body. Most fluid is discharged from the body as urine. Output also includes emesis, vomitus, drainage from a wound, loss of blood, and excessive perspiration. Every time the client uses the urinal, emesis basin, or bedpan, the urine and other fluids must be measured. For perspiration, wound discharges, or bleeding, indicate what was wet, how wet, the size of the wet area, and the time it occurred. A client is receiving oxygen therapy via face mask. Which of the following is contraindicated for this client?
A,
Eating his lunch.
B,
Use of cotton bedclothes.
C,
Shaving using an electric razor.
D,
Talking with visitors. Correct answer, C. Shaving using an electric razor. A client who is in oxygen therapy should have safety measures implemented in order to prevent explosion. Use of electric razors or hair dryers while the oxygen is running is not allowed. Combing a client's hair can also create a spark of electricity from his hair that could set off an explosion. The face mask can be removed if the client wishes to eat and converse with visitors. Use of cotton bedclothes is also encouraged to decrease static electricity. Use of which of the following articles or types of clothing would help a client with osteoarthritis perform activities of daily living adequately?
A,
Zippered clothing.
B,
Tied shoes to promote stability.
C,
Velcro clothing, slip-on shoes, and rubber grippers.
D,
Button clothing, slip-on shoes, and rubber grippers. Correct answer, C. Velcro clothing, slip-on shoes, and rubber grippers. Velcro clothing, slip-on shoes, and rubber grippers make it easier for the client to dress and grip objects. Zippers, ties, and buttons may be difficult for the client to use. Which of the following is not included in the care of clients with a pacemaker?
A,
The client is not allowed to be around electrical appliances.
B,
The client can operate a microwave.
C,
The client should avoid magnetic wands in airports.
D,
Cellular phone use should be monitored closely. Correct answer. A. The client is not allowed to be around electrical appliances. Clients with a pacemaker can use electrical appliances. Microwaves are allowed, but caution must be used in airports to avoid the magnetic wands used for detection. Some clients have difficulties being around lawn mowers and cellular phones. Your client has had a bowel movement. The stool is black in color and has a tarry consistency. What is your next action?
A.
Ask the client what her previous meal contained.
B.
Ask the nurse to observe the stool.
C.
Dispose of the stool and report the color to the nurse.
D.
Ask a coworker if this is normal for this client. Correct answer. B. Ask the nurse to observe the stool. The nurse aide should report to the nurse any abnormal stools. Carefully observe the color, amount, consistency, odor, shape, size, frequency of defecation, and complaints of pain. Which is not a rule for collecting specimens.
A.
Follow the rules of medical asepsis.
B.
Use the correct container.
C.
Label the container accurately.
D.
Collect the specimen when you have time. Correct answer. D. Collect the specimen when you have time. Collecting the specimen at the convenience of the nursing assistant is not a rule to follow. It should be collected at the correct time. Specimens are collected and tested to prevent, detect, and treat disease. The doctor orders what specimen to collect and the tests needed. A nursing assistant will be changing the soiled bed linens of a client with a draining pressure ulcer. Which of the following protective equipment should the nursing assistant wear?
A.
Mask.
B.
Clean gloves.
C.
Sterile gloves.
D.
Shoe protectors. Correct answer. B. Clean gloves. Clean gloves protect the hands and wrists from microorganisms in the linens. Sterile gloves allow one to touch a sterile object or area without contaminating it. A mask protects the wearer and client from droplet nuclei and large particle aerosols. Shoe protectors prevent static and microorganism transmission from the floor of one room to another. A client has an indwelling urinary catheter and urine is leaking from a hole in the collection bag. Which of the following actions would be most appropriate?
A.
Cover the hole with tape.
B.
Report to the nurse immediately.
C.
Disconnect the drainage bag from the catheter and replace it with a new bag.
D.
Place a towel under the bag to prevent spillage of urine on the floor, which could cause the client to slip and fall. Correct answer. B. Report to the nurse immediately. The system is no longer a closed system and bacteria might have been introduced. The nursing assistant should report to the nurse immediately for the removal of the catheter and inserting a new one using sterile technique. Placing a towel under the bag and taping up the hole leave the system open, which increases the risk for infection. Replacing the drainage bag is not recommended due to the limitations of the duties of the nursing assistant and the increased risk of infection.